My message to Congress basically was the patients I care for can't speak for themselves, and that it is extremely important that we change and get healthcare reform now, not only for the generation that we're in right now, but for the future generations.
Day in and day out, people come in and I say, your pressure's high. Well, I've had to cut back on my medicine. I can only take it every other day. And that happens too many times.
At this particular hospital, we care for a large number of women that don't have health insurance, that don't qualify for health insurance. And so many of them, even if they are able to get some form of health care during their pregnancies, they're not able to get the quality of care nor all the testing that they really need to get during their pregnancies, so they don't have as good a chance of having a healthy pregnancy and having healthy babies.
How good a nation is doing depends on the health of the people. And I happen to work in an area where infant mortality gives that certificate of how well a nation is doing. We are not doing very well compared to the other civilized nations. We need to improve health care, we need to improve prenatal care, we need to improve infant mortality.
I wrote down that I have 4 kids and I would like insurance that I can afford to pay, because sometimes I have to work overtime to get to pay my insurance or to get some extra money.
This is the time. The time is now and not later. There's no reason why we should be postponing and pushing the time to make the reform. The time is now. If only everybody put their hands together, I think we can do these things. But what the unfortunate thing is to start lying and to start misinforming people, all in the effort to derail a change. That, I think, is to nobody's benefit. However, one thing I'm sure of is that we can't continue the way we are. We need to change.
Caregivers are the frontline people. We know what's wrong with the system, and we know many times what needs to be fixed in the system. And listening to the massive amount of misconceptions that are out there, we need to make sure that the public, that the community understands what the real reform is about and why it's so necessary for all of them.
I think it's our job as healthcare professionals, as healthcare workers, is to pass along the information that we know to be correct. Our system is broken, it needs fixing now. We need to be proactive and not reactive to the healthcare crisis.